"15-year-old Jordan Jacobs is passionate about playing drums in his high school band.
It's just really fun. I love it.
Jordan also loves basketball, baseball, and track. But sports have been frustrating at times because Jordan has battled a life-threatening medical condition for most of his life.
The first time that Jordan started having problems with his eye was just a few days after his 4th birthday.
In Kansas, doctors thought a food allergy was causing his swollen left eye. Then, doctors in Maine thought it was brain cancer. Finally, doctors in Massachusetts identified Jordan's real problem, orbital lymphangioma, an abnormality in small tubes that drain fluid from the eye. The fluid buildup causes cysts that surround his eyeball, triggering severe headaches, nausea, blurred vision, bleeding, and a dangerous drop in heart rate.
If the doctors would go in and lance it and drain it, and it always filled back up.
It's just scary. I mean, it's not knowing what's going to happen day to day is kind of scary.
The real danger for Jordan would be that it would bleed too quickly and it would actually push the eyeball completely out of the socket. And if that happened, then obviously he would lose his eye, but at that point, then bleeding could be out of control.
5 surgeries later, with no cure, Jordan's parents considered removing the eye.
We were told in very clear language that this would be something he would live with forever.
Fortunately, their path led them to Nationwide Children's Hospital in Columbus and Chief of Radiology, Dr. William Shields.
And I said, "Hi, my son has orbital lymphangioma," and the lady on the end of the line said, "You've got the right number."
So this is blood pushing the eyeball out of its socket, stretching the optic nerve, and causing intense pain.
Dr. Shields and his team have created a new cutting-edge cure for kids like Jordan, never seen before in the world, using an interventional radiology tube and a 2-drug treatment, all developed at Nationwide Children's Hospital.
We were able to drain the fluid that built up the pressure in his eye socket and then use 2 different drugs to kill the cyst that actually produced the fluid and then reduce it and eliminate the cyst from existing to essentially kill the cyst.
The best part, besides curing Jordan, it didn't even require surgery, just an outpatient procedure that took an hour.
We can go in through an opening no bigger than the end of a pen, go in through the eyelid, go into the eye socket, do all of our work, and have essentially little to no hospitalization and no scarring when we're finished, and a better response with 100% success.
Emmy, come here, Emmy.
In 3 days, Jordan was a new teenager. His 10-year hunt for help, history. The Jacobs family now has a lifelong bond with the Nationwide Children's expert who changed everything.
I just could never have imagined a more caring, thoughtful, personally involved doctor who I know that he cares about my son.
He was a fragile, medically dependent child his whole life.
And now?
Jordan is awesome.
Jordan's back.
To be able to help children like Jordan in situations that essentially are hopeless as far as their family is concerned is an honor, and we're fortunate to be able to have all of the resources and the innovation to be able to provide these children with a cure for the first time in their life.
And for the first time in his life, Jordan can see an open road of possibilities ahead.
I feel like I have a lot more to look forward to in life without the distraction of the medical problems. Dr. Shields just improved my life drastically.